Hello! Right, I'm making a little video today about what it's like being a mental health nursing student. Just because I've had quite a lot of questions on my blog about people uncertain about if it's for them, should they do it, should they spend 3 years of their life doing a degree where they've got to work half the time, in order to be a mental health nurse. I mean, what's it involve? Is it scary? So I'm going to answer a few questions. So what do we do in uni? Well, basically half the year we're actually studying in lectures. So we have about three days of lectures a week on things such like, learning about all the different mental health problems, and then things like the importance of reflection. What else? Anatomy and physiology, things like that. It's probably not the most interesting part of the course, but obviously because it's a degree, you have to do it. And then the rest of the year is spent on placement. So I'm not sure about the other universities in the UK, but in our one, it's 6 placements in all of the 3 years. So you do 2 placements a year. Now these can be anywhere, they can be in places in dementia hospitals, in eating disorder, teenager CAMHS units, in forensic places, in acute mental health wards, in community placements, and in rehab settings as well. There's loads of different places. Is it hard? Academically, I think if you've done alright in your A-levels or done alright in your access course, it'll be alright. Emotionally, it is quite challenging sometimes. You do see and hear things that can be, you do take it away, you don't kind of go home and not think about it. I had one woman, tell me that she wished her husband had died of a heart attack because seeing him with dementia was so painful. She just wanted him to die, And I sort of had to reply to that. How do you reply to that? If you think that you can have a sort of alright answer to say to someone who says that to you, then I think you'll probably be alright. You see young people that have got psychosis so bad that they don't even recognise any of their family, and they just scream at them. They don't even recognise their own mum. They're just constantly sort of screaming and talking to things that aren't there. But a lot of it is really, really fascinating. A lot of people have asked me over the years, can you be a good mental health nurse if you've got your own mental health problems? Well, I think the answer to that is, as long as it doesn't affect you turning up to work, you interacting with the patients, and you interacting with your co-workers, because teamworking is really important in the job. Well, why should it matter? I think, especially in this field, you won't meet anyone that hasn't had past issues or hasn't had friends or family with past issues. Human beings are vulnerable. Everyone's got their past, but you don't need to really go into it. You're helping other people, not yourself, so it shouldn't matter. They do teach you before you start uni what kind of characteristics you need to be a good mental health nurse. You've got to be compassionate, you've got to be patient, you've got to be a good listener and a good communicator. Well, I don't really know anyone on my course that's not naturally sort of kind, that naturally has those good lovely vibes that you wouldn't feel at ease with telling your problems to. As long as you've got that, then I think you can learn the rest, because I didn't have any experience whatsoever. The only jobs I'd done before I started my course was I worked in KFC, which was awful, and I worked as a lifeguard as well, and that was basically it. But as long as you've got a kind of fairly base idea of mental health problems in general, then I think you'll be fine.